Hi there, welcome back to Health Heart. Today, we're diving into a topic that's often misunderstood: why some women may not want or enjoy sex. Let's face it, talking about sex can be awkward, but it's also incredibly important for building healthy and fulfilling relationships. By the end of this video, you'll be able to identify some reasons your partner might feel this way and how to approach these sensitive issues. I'll cover 5 key reasons and share important tips on handling this delicate situation. Make sure to watch until the end for some crucial insights. Let's jump right in. The first reason on our list is pain. Pain can significantly impact desire. Some women experience pain due to pelvic floor dysfunction. This happens when pelvic muscles don't relax, causing discomfort. Another cause is a retroverted uterus, where the uterus tilts backward. About 25% of women have this, making deep thrusts painful. Pain can also lead to emotional stress and anxiety. Hormonal changes can cause vaginal dryness and burning sensations. Imagine feeling like your vagina is on fire during sex. Approach the situation with empathy and understanding. Encourage her to see a doctor for potential treatment options. The second reason is stress. We all experience stress differently, and while some men might find stress relief in sex, women often experience the opposite. Think about it. When you're stressed, your mind is racing, your body is tense, and the last thing you're probably thinking about is sex. Stress can significantly lower a woman's libido. If she's feeling overwhelmed or pulled in many directions, sex will likely not be a priority. It's like trying to enjoy a delicious meal when you have a pounding headache. It's just not going to happen. Stress triggers the release of cortisol, which can interfere with the hormonal balance necessary for sexual arousal and desire. Cortisol is often referred to as the stress hormone, and for good reason. It's our body's natural alarm system, kicking in when we're faced with a perceived threat. High levels of cortisol can also contribute to mental health issues like anxiety and depression, further diminishing libido. Anxiety can manifest as constant worry, racing thoughts, and difficulty relaxing. Depression, on the other hand, can lead to feelings of hopelessness, fatigue, and loss of interest in activities that were once enjoyable, including sex. If she's not mentally ready, sex is off the table. It's like trying to force a flower to bloom before it's ready. It's not going to happen, and you'll likely damage the flower in the process. Instead of pressuring her, focus on creating a safe and supportive environment where she feels comfortable communicating her needs and desires. Chapter 3: The weight of psychological factors. Next, let's talk about psychological factors. Our mental and emotional well-being plays a huge role in our sexual desire and satisfaction. Anxiety, depression, relationship issues, or a history of sexual trauma can all affect a woman's interest in sex. Anxiety can make it difficult to relax and be present in the moment, which are essential for enjoying sex. Depression can zap your energy and make it difficult to feel pleasure. Relationship issues, such as communication problems or unresolved conflicts, can create distance and resentment, making intimacy challenging. And then there's sexual trauma, which can have a profound and lasting impact on a person's sexuality. It can lead to flashbacks, triggers, and a deep-seated fear of sex. If your partner has experienced sexual trauma, it's crucial to approach the topic with sensitivity and understanding. Understanding her sexual history and mental health can provide insights into her libido. Have an open and honest conversation with your partner about her past experiences and how they might be affecting her present. Encourage her to seek professional help if she's struggling with any of these issues. In such cases, seeking help from a mental health professional can be beneficial and potentially help her work through these underlying difficulties. A therapist can provide a safe and confidential space for her to explore her feelings, develop coping mechanisms, and work towards healing. Chapter 4: Unpacking Low Libido and HSDD. The fourth reason is low libido or hypoactive sexual desire disorder, also known as HSDD. HSDD is when someone consistently lacks interest in sex, causing distress or relationship problems. It's not just about having a lower sex drive than average. It's about a lack of desire that causes significant distress or interpersonal difficulties. It's more common in women, but can also affect men. While it's often associated with women, it's important to remember that men can experience low libido as well. Those with HSDD rarely think about sex or want it, and this lack of desire is long-lasting. It's not a temporary dip in libido due to stress or a busy schedule. It's a persistent pattern that can last for months or even years. Causes can include hormonal imbalances, health issues like diabetes, mental health conditions, past trauma, or ongoing stress. Hormonal imbalances, such as low testosterone levels, can dampen desire in both men and women. Certain medications, like antidepressants, can also have a negative impact on libido. Additionally, some women have what's called responsive desire, meaning they might not initiate sex, but enjoy it once it starts. They might not have spontaneous desire, but they can get aroused and enjoy sex once they're in the mood. It's important to remember that everyone's libido is different, and there's no normal level of desire. If you're concerned about your partner's low libido, encourage them to talk to a healthcare professional to rule out any underlying medical or psychological conditions. Chapter 5: Understanding Asexuality. Lastly, let's discuss asexuality. Asexuality is often misunderstood, so let's break it down. Asexuality is a sexual orientation where a person doesn't experience sexual attraction to others. They might enjoy cuddling and intimacy, but don't feel the desire for sexual activity. Asexuality exists on a spectrum, and each person's experience is unique. It's different from abstaining from sex for religious or philosophical reasons. It's not a choice. It's an inherent part of who they are. It's not a reflection of their feelings for you. A fulfilling relationship is possible without sexual intimacy. Outro. Open communication is key. Communication is crucial in any relationship, but especially when dealing with these issues. Discuss expectations and boundaries openly to help navigate your relationship. Don't be afraid to have those sometimes awkward conversations about sex and intimacy. Ask questions about future sexual activity, thoughts on non-sexual intimacy, and comfort with sexual topics. The more you understand each other's needs and desires, the better equipped you'll be to navigate these sensitive topics. Understanding the reasons behind a woman's low interest in sex and addressing them thoughtfully can strengthen your relationship. It's not about fixing her or changing who she is. It's about creating a space of understanding, empathy, and support. If any of these factors are deal breakers for you, it's important to consider what you need in a relationship. Thanks for watching, and I hope this video has provided some valuable insights. See you in the next one.